So, welcome to this lecture where I intend to give a brief overview of the Vantage frame, intended for experienced users already working with the Leksell G-frame. If you are not used with the G-frame, or if you would like to have a more detailed introduction, then please look at the full-length lecture on the Leksell Vantage system. The Vantage is the successor of the Leksell G-frame, and the principles will be familiar to users of the older model. The new model has many advantages. It has fewer parts, it is faster to work with, and it provides a good access to the skull. Further, if you do a weight surgery, it is likely to be more comfortable for the patient, and most importantly, the accuracy seems to be excellent. Let's have a look at the frame. The higher part of the frame is the anterior part, and the frame has 4 lateral holes for the screws and 4 central holes, and normally we are using the lateral ones. It is easy to mount, even without an assistant, and I will place the screws on a line about 3 cm above the eyebrows. I will strive for a symmetrical placement, but this is of limited value. The Vantage can be placed asymmetrically and allows for very individual adaptations, as you can learn more about in this lecture by Marie Krüger. Before mounting the frame, we will place the band on the frame, the wider straps goes to the sides, and I will place the end of the strap at the lowest white marking. You can later optimize this when the frame is on the head. Then lift the frame in the band and place it symmetrically on the head, and align the frame so that the holes for the screws are at the desired height. Try to have the same distance from both the posterior screw holes to the skin, and from both of the anterior holes. However, it is not necessary to have the same distance between the posterior and the anterior holes and the skin. Then enter a pen for the lateral screw holes and mark where you want to put the screws. Introduce the measuring stick for each hole all the way to the skin and look at the color marking outside of the frame, which in this case is blue, and we're thus going to use the blue screws on the back. Arrange the frame so that you have the same screws in the 2 posterior holes and the same screws in the 2 anterior holes. Remove the measuring stick and you can now administer the local anesthesia before or after you have removed the frame. We then open the packages with the desired screws, and we insert the screw holders with the screws from the inside of the frame. And we lock them on the outside of the frame with the ring as seen here. Now, with the help of your markings, place the frame in the same position as before. If a screw holder is pressing against the skin, then start by advancing that screw, so that only the screw itself is in contact with the skin. Tighten the screws in the same manner as with the G-frame. When finished, remove the band. If you look at the screws, then you will see that there is a blank square in the grooves in the distal end, close to the tip. This is of no interest. However, in the proximal end, you will see a narrow rectangle, which is of importance. You should never advance the screw so far that this becomes visible outside of the screw holder, since that might affect the stability. If you need to advance the screw further, then it is possible to just replace the screw itself, but the manufacturer recommends to remove the frame and change both the screw and screw holders to the next length. All these steps takes about 4 minutes, and let's see how it all comes together in this video, which I have speeded up somewhat. The MRI fiducial box is simply a more advanced version of the older model and is used in the same fashion. The box is simply placed on the frame and locked in place as seen here. And it is not possible to lock it in the wrong place. You then add the MRI head coil adapter, a support for the frame in the MRI head coil. For an intraoperative CT or O-arm, we first place the patient with the frame in the frame holder as seen here. This should be a smooth process, and if you're using a lot of force, then you're probably not doing it the right way. The patient is then attached to the operation table or CT table. The CT fiducial box has 3 pins that will fit into holes in the frame holder. And you simply put it on in this manner and lock it in place. The frame coordinates are exactly the same as for the G-frame, and when you have calculated these, we will proceed with the surgery and with the rest of the Vantage system. And the scales will be familiar to all users of the G-frame. And it is the same thing if you're setting coordinates without a decimal. Simply align the index mark with the number in question on the main scale. However, with Vantage we can set the coordinates with submillimetric precision by using the Vernier scale. Place the index marker at a whole number and then move it slightly so that the desired number of the decimal on the Vernier scale becomes aligned with the marking on the other side on the main scale. Let's say that we want to set the scale at 112.3. Then we start by placing the index mark at a whole number, that is 112 as in this image. We then push it gently in the direction of the next higher number, that is 113, but we stop before reaching this, at a point where the third marking on the Vernier scale is aligned with the marking on the other side on the main scale. And as you see here, only one marking of the Vernier scale will be perfectly aligned with any of the markings on the main scale. A major difference with the Vantage frame is the mounting of the Y scales. These are attached to the frame holder after you have dressed the patient and after you have covered the frame with a plastic sheet. Make sure that the plastic sheet is stretched above the frame holder without any folds. The left and the right Y scales are not identical, so make sure that the marking with the text anterior is in the corner pointing towards the nose and the top of the head. If you have the wrong scale, then it will not fit in the frame holder. While your assistant is stretching the plastic sheet, press the screws through the plastic sheet and then tighten them. With this solution, you can now change the Y and Z coordinates during surgery without the risk of compromising the sterility. Then, as with the G-frame, slide the left Z scale into the left slider and the right into the right. Set the Z coordinate on the Z scale and lock the screw. And as with the G-frame, slide the slider with the Z scale onto the Y scale and set the Y coordinate and lock the screw, and repeat on the other side. The arc in the Vantage system consists of 2 components, and we start by simply sliding the arc over the support arc, and this is clicked into place. Then tighten the screw somewhat in order for these 2 parts not to separate again, and set the X coordinate before locking the screw. This can be done while holding the arc upright or in a flat position. The X coordinate is set by using the large X scale on top of the arc. Make sure that you are using the scale with the numbers directly facing the index mark and not the numbers below, which are used for a lateral left approach. And you can also see the X coordinate at the smaller scale at the front of the arc. The instrument carrier, instrument guide holder and stop are the same as in the G-frame, and the arc angle and depth are set in the same manner. The arc attachment to the set scale differs from the G-frame. Make sure that the screws to the ring clamps and the ring clamps, which you see here, are fully open. As with the G-frame, the arc can be attached facing forwards in the lateral right position, but also in a lateral left position with the arc facing backwards, but we will only look at the first option here. Put the rings on the set scale on both sides in simultaneously and parallel. A distinct sound should be heard when the ring clamps locks in place. If it is difficult to get the arc into position, then recheck if the screws to the ring clamps are open enough, and that you have set the correct coordinates on the Z and Y scales on both sides. Tighten the screws and set the correct ring angle before tightening them completely. The rest of the surgery does not differ between the old and the new frame, but I will just show you here how easy it is to do the tunnulation of the connection cable with the Vantage frame. There is really no need to remove the frame and redress the patient before implanting the connection cables and the IPG. And this thus of course saves a lot of time. And with that I end this short overview. If you're interested, more presentations are available at the Stereotactic Academy. Thank you for your attention.